Hey, Dan, you and I don't get to have this conversation in person because of COVID right now, so we're having it on Zoom. But I got a text this week from a loved one who sent me the name of a new doctor they were going to go see. And the loved one said, "Hey, Lauren, would you look this person up for me?" And I spent about the next 30 minutes online doing a bunch of research. So I was hoping that you could tell potential clients a little bit more about how you can do that before an appointment.
Sure, happy to. The first thing I think people should look for, they want a doctor who is not too young and not too old. You want somebody who's probably in the ideal time frame or sweet spot, might be 45 to 55 or 60 years old. They're still very active and they have a busy practice, and yet they have enough experience that helps them avoid some of the problems that less experienced doctors have.
Right.
So that's the first thing I would tell people. The second thing, and you and I have talked about this before, the internet's your friend, and you can go on the Virginia Board of Medicine site, and you can find out where your doctor was trained and where your doctor is licensed. And there's even a provision or section in there that tells whether or not that doctor has had malpractice claims successfully prosecuted against him or her in the past.
Right.
But there's a caveat with that, as you know, that's self-reported. The doctor has to report it before it ever shows up there.
Right.
But I tell people all the time that if your doctor was trained in the Anguilla School of Medicine and Taxidermy, I would probably avoid that doctor if I could.
Right. That's exactly right. And along those lines, Dan, you and I have discussed for years that the average patient doesn't know the difference between a PA, a nurse practitioner, a DO, and an MD. So what initials do you want to see ideally from your healthcare provider when you're looking them up before an appointment?
I'm not only should you look for a well-trained physician, but it also should be someone who has an MD, medical doctor, after their name. While there are DOs out there, and that's a person who's gone to osteopathic school, and they have a degree called a Doctor of Osteopathic Medicine. Some of them are good. Some of them are not. But if I had my druthers, I would rather have an MD treating me and dealing with my problems. And a lot of times, as you've mentioned, you're in big facilities and whatnot, and people come in your room and talk to you, and you call them doctor. Well, they may not be a doctor. They may be a nurse practitioner or a physician's assistant. So you kind of need to know who the Indians are and who the chiefs are.
That's right. And as we have learned, not every caller who calls us has a case of malpractice, but so many people feel distrust with their providers. And so this information is just basically a public service announcement of how to know more about your doctor before you receive care, during your care, how to investigate them such that that trust does build. So God forbid there's a bad outcome. It's not a trust issue alone.
And confidence provides you with a level of trust. And if you've done homework, that helps you have confidence and trust in your physician.
That's right. All right, Dan. Well, thanks for having this conversation on Zoom with me today.
Okay, bye-bye.